I'm 60 years old right now, and I only came out when I was 57. I've known it about myself all my life, but having a very deep religious background, I did not feel comfortable, acknowledging this about myself.
When I finally came to the conclusion and I realized who I am as a human being, I'm at a crossroads in my life, and that's a scary moment. The world's not very forgiving.
I didn't come out until I was 38 years old because I was so freaking terrified. And at that point, I'm like scared to even leave the house or the car, waiting to go into an appointment, and things shouldn't be like that.
Just being a patient and going to a doctor is absolutely terrifying. I don't want to have to out myself every time, and I want to be respected. We deserve that.
After about a year of therapy, I realized, okay, I gotta go meet some people who are like me. And I came to SAGA, the Sexuality and Gender Acceptance Community Center. It's one of the most welcoming, open groups that I've ever experienced.
In 2017, I met Josh Blakesley and just happened to get into talking with him about starting some sort of community organization for LGBT plus folks in Montgomery County, which is where I'm from. He basically said, that sounds awesome, we should do that.
Some of our leaders just shared, their horrific experiences, to be frank, here in the suburbs. They're looking for doctors who were safe. And as we talked about it, we said, why not we start talking to doctors?
Trans and intersex people experience a ton of violence from medical providers, and then the onus is on them to teach providers how to give them care. And it's a big reason why trans people don't go to the doctor. We
started with members of SAGA Community Center and their doctors who they felt safe with. And then Dr. Jimmy Ruiz reached out to us and said, what if we fashion our own training program that our LGBT plus cohort creates? And then we work with doctors to make it something also effective in their context.
Back in June, there was a panel discussion hosted here at Jefferson Abington to share our experiences from both sides.
I have horror stories, and specifically ER horror stories of being asked things like, oh, are you going to get the surgery? And I'm like, I am here because I have a rash, and now you're asking me this thing that's very invasive about my body, and I don't know you. What is, quote, the surgery you're referring to?
They could just come out and use your last name, and they refuse to, and they want to out you in the middle of the office, causing a situation where it's uncomfortable, where you have to walk out with people that are homophobic or transphobic and following you out to your car in the parking lot. I've had that happen. Doctors not knowing the proper amount of testosterone that I should be on, just handing me needles and taking them home and being like, here, figure it out.
I think that we had, when I was in medical school 3 or 4 years ago, an hour or two focused on this conversation, and that's it. We have to find a way to educate people to be better for patients.
We already are lining up so many medical offices and doctors who actually want us to be a part of this. That already is giving me chills.
We hope to standardize the training so that healthcare practitioners all across the country can get this training and become competent.
We have some amazingly courageous people who are willing to be asked questions that are difficult questions, that doctors and nurses and other medical professionals just want to know, and they're afraid to ask.
My hope remains, no matter what an individual's gender identity may be, that they are comfortable going to a provider.
I so want things to be easier for younger trans people. I don't want them to wait until they're 57, and I want to make it as easy as possible for them.
I guess the last message I would want to give is just meet me, meet me as a person. I'm a person, and I think we'll get along just fine.